Hello, it's Dr. Elizabeth Alter. Do you have osteoporosis? Osteoporosis is a somewhat complicated situation. So there's a lot about prevention, as I've mentioned in other videos, but once you have the disease, it's not quite so easy. The issue is that really bone loss starts at the age of 30, and unless you're attending to it from that age forward, by the time you get diagnosed, whether it's in your 40s or 50s, um, it's not that it's too late, but it's really hard to reverse the situation. Now, there's certain things that will help, and of course, the first thing is exercise. So, the analogy is to the bones are a construction site that has all the cement. Um, um, the equipment, but no workers. So you need to work on your bones to build them. So the resistance training, um, whether it's bouncing on a rebounder, jumping rope, these exercises, weight training for sure, is going to help build the bone. Now, it depends on how much bone is lost already, but usually the more you exercise, the more you're building bone. And then the cement part is the vitamin D, magnesium, a lot of trace minerals, as well as magnesium, an often forgotten nutrient with bone health. So some calcium, a lot of magnesium, vitamin D. And then the last part, which is a little more difficult for most patients, and this includes both men and women, is hormones. You need your hormones to maintain and build your bone. So for women, if you're perimenopausal or postmenopausal, the importance of not just estrogen but also testosterone and the combination of the hormones. So hormones are commonly referred to as a symphony, and that's why, because you need a network of hormones to keep your bones strong. And in men as well, especially in men, the dominant hormone is testosterone, which is very important for bone health as well as in women. The other big issue is that a large percentage of Americans have thyroid issues, and they're immediately put on thyroid medication. And this is it's a very difficult part of the osteoporosis picture, because you have patients that need their medication, especially if they've been on it for more than 4 or 5 years. But also, you know, if they need the medication because of their disease, it encourages bone breakdown as opposed to bone building. So these are all issues that are important. So in terms of treatment, though, I have patients that refuse to take the conventional um, medications, and that has to be a decision between you and your family, and of course your doctor. Your doctor gives you the pros and cons to each of the medications, um, and that you need to make that decision for yourself if you're not going to do the medications. The medications is a whole video on it to itself, but um, there are definitely some cautions to be taken with the medications. Um, so the other aspect is, okay, so let's say you can't do hormones for whatever reason, a history of breast cancer, family history of breast cancer, you now have osteoporosis. The other aspect that isn't often spoken about in this subject is how reliable are bone density tests. Um, so bone density tests, BMDs, are based on 20-year-old bones. So, so yes, we all should have the bones of a 20-year-old. That's the optimal bone health. But there are some questions of whether the studies overread. There are some urine tests to know how much bone you're actually losing. I don't do that routinely, but I know it exists. Um, so there's a lot going on when it comes to osteoporosis. So if you're in your 50s or 60s and you're being given this diagnosis of osteoporosis, yes, you can do something about it, but is your next bone density going to be great? It's going to take some time, a long time, to really build up the bone unless you do the medications, and then the medications have their issues as well. But always keep in mind that regardless, you should be on your vitamin D, and that your vitamin D levels should be high enough. Magnesium every night, a good multivitamin that has good trace minerals, and I like calcium, but just about 3 or 4 nights a week. At most, because we're an overcalcified society, and we have the highest incidence or occurrence of osteoporosis. So there's an issue there, either of absorption or not getting the right type of calcium, and also because we're more of a sedentary society overall. Well, I hope this helps, and have a healthy day. I'll include the links to the products in the description.